Hi, my name is Brandon McDonald. I'm a physician assistant student with the University of Pittsburgh. I'm here to perform a neurologic exam. Is that okay with you?
Mm-hmm.
Good.
Yes.
Before we get started, can you confirm your name and date of birth?
Chanel Enriquez, September 26, 1995.
Great. So I'm dressed professionally. I would be in a white coat if I had one, with a name tag on as well. I performed hand hygiene. We're in a well-lit room. Chanel's sitting on a chair right now, but if she was on a table, I'd make sure she had a clean piece of paper. So we'll start with cranial nerve number 1, the olfactory nerve for patency and for sense of smell. So go ahead, take a deep breath in for me. Good. And the same thing on the other side. Good. And then include one there. Tell me what that smells like.
Coffee.
Good. And do the other side. Tell me what that smells like.
Candle.
Good. Next, we'll assess cranial nerve 2, optic nerve for visual acuity. So I'd like you to cover one eye. Do you wear contacts or glasses?
I do not.
Could you cover one eye for me? And then read the lowest row you can from left to right.
A, B, G, F, H, I,
Good.
J.
Good. And then switch hands and read the lowest line you can now from right to left.
Z, W, X, R, T, Y.
Good. Thank you. Next, we'll assess cranial nerves 3, 4, and 6, which is oculomotor, abducens, and trochlear. Without moving your head, follow the tip of my hand. And with that, I'll be assessing for any ptosis, nystagmus, or accommodation. That's cranial nerve number 5, the trigeminal nerve. Could you go ahead and clench your teeth down for me? Good. I'm just going to palpate the bilateral masseter muscles. Good. And then stick your hand out for me. Good. This is going to be sharp, and that's going to be dull. I'm going to touch different spots in your face. You just tell me when you feel what. Okay. This is the ophthalmic branch. Good. Close your eyes.
Sharp.
Good. This is the maxillary branch.
Sharp.
And then this is the mandibular branch.
Dull.
Good. You can go ahead and open your eyes, and I would then do that on both sides. Next, we'll move on to sensation. Could you put your hands out for me? And whenever you feel that on your face, you're just going to say now. Okay. Go ahead and close your eyes for me. This is the ophthalmic branch.
Now.
This is the
Now.
maxillary branch. And this is the
Now.
mandibular branch. Good. Next, move on to cranial nerve. You can open your eyes for me. Next, we move on to cranial nerve number 7, the facial nerve. Could you go ahead and raise your eyebrows up for me? Good. Close your eyes. Hold them real tight. Don't let me open them. Good. You can open your eyes. And now puff your cheeks out. Let me see you smile. Let me see you frown. Good. And with that, I would be assessing for symmetry, facial symmetry and movement. So we'll assess cranial nerve number 8, the auditory nerve, with the whispered word test. I'm going to go ahead and close off one side. Close off this side. Tell me a word that I say.
Football.
Good. And if you stand on my phone, just to the other side. Good, good.
Is that good?
Yep.
Pittsburgh.
Good. If there were any abnormalities in that test, I would then move on to the Weber and Rene test. We'll assess cranial nerves number 9 and 10, the glossopharyngeal nerve and the vagus nerve. The patient has been talking to me, and then could you go ahead and open your mouth for me and say ah? Good. And then we'll assess cranial nerve number 11, the spinal accessory nerve. Can you shrug your shoulders up for me? Good. Don't let me push you down. You can relax and turn your head to the one side. Good. Turn your head to the other side. Good. Assess cranial nerve number 12, the hypoglossal nerve. And could you open your mouth and stick your tongue out? Good. And I'd be looking for any fasciculations or deviations. And then could you push your tongue into your cheek? Don't let me push back. Good. Do the same thing on the other side. Good. All right. Next, we'll move on to the motor exam, and we'll be assessing the axial and extremity musculature for bulk, for involuntary movements, for contour, for atrophy, position, and posture. So we'll start with passive range of motion, observing force, passivity, or rigidity with elbow flexion and extension. You just relax, let me move you. Good. Same thing with your wrist. Relax, let me move you. Good. And then we'll bring your knee up into extension. Good. And deflection. And then her ankle up into dorsiflexion and plantar flexion. We'll also assess hip flexion and extension. So good. And then extend it down. Good. AB duction. And then bring it inward. AD duction. And bring her up here into external rotation. Internal rotation, and then external rotation. Good. Go ahead and set up for me. Next, we will assess strength. So go ahead and push your arms up against me. Good. Push down against me. Good. Go ahead and grip my fingers, and then pull me in towards you. Good. So that would get grip strength and elbow flexion. And then could you push your wrist up into me? Good. Turn it over. Push it up now. Good. Bring your hands out wide here. Good. Squeeze in against me. Good. Open up, squeeze. Open up, squeeze. Good. Bring your thumb to your pinky on both sides. Good. And then try and break that. Good. So I've done most of these unilateral. I would then do these all bilateral. I'll assess for lower extremity strength and having the patient stand up. Could you go ahead and stand up for me? That assesses for proximal muscle strength. And then could you go ahead and walk for me? Take a couple normal steps. Good. Assessing the gait for balance, for arm swinging, and for posture. Could you go ahead and come back taking tandem steps, one foot in front of the other? Good. Good, good. and then turn around. And you can walk there only on your heels. Good, turn around, and walk back only on your toes. Good, thank you. We'll assess coordination and rapid alternating movements. So I'm going to put my finger out here, and I want you to touch your index finger to the tip of your nose, and then touch your index finger to my index finger. But I would be moving it around. Go ahead. Good, go back to your nose one more time. Good. And then I would assess both hands. And now we will do the foot tap test. So go ahead and alternate, tapping your feet down to my palms one at a time. Good. Pick them up a little bit higher. Yep, good, good, good. Thank you. I will assess sensation doing sharp and dull again. So like you remember from before, we'll start with the lateral shoulder, C5.
Sharp.
Good. Can I see the inside of your hand? Good.
Sharp.
Good. And then her middle finger.
Dull.
Good. And the thumb was C6, middle finger C7, fifth finger C8.
Dull.
Okay, medial forearm T1.
Dull.
Yeah. And then we'll go here, chest T4.
Sharp.
Yeah. Umbilicus T10.
Dull.
Yeah. Come down chain here, we'll go distal medial thigh L2.
Sharp.
Cross the lower thigh, lower leg L3.
Sharp.
Medial malleolus L4.
Sharp.
Lateral malleolus L5.
Dull.
And then the fifth toe S1.
Sharp.
Good. We'll continue assessing sensations, so I'm just going to touch this to you, and you feel it, you say now with your eyes closed, right? Good. Close your eyes for me. Lateral shoulder C5.
Now.
Good. Tip of the thumb C6.
Now.
Tip of middle finger C7.
Now.
Tip of the fifth finger C8.
Now.
Medial forearm T1.
Now.
Good. We'll go T4.
Now.
T10 umbilicus.
Now.
Good. Proximal medial thigh L2.
Now.
Distal medial thigh L3.
Now.
Medial shin L4.
Now.
Lateral shin L5.
Now.
Tip of the fifth toe S1. Check a few other sensory things, so we'll start with vibration. I want you to tell me if you feel pressure or vibration here on the tip of your thumb, right?
Vibration.
Good, and tell me when it stops.
Stop.
Good. If that was abnormal, I would move to another bony proximal bony prominence, and also do the same thing on the tip of her first toe as well. And I'll move on to proprioception, so I'm going to move your thumb up and down. Right? You can keep your eyes open for now. That's what up feels like, and that's what down feels like. I'm going to have close your eyes. I'm going to move it up and down, and you tell me when I stop if it's up or down.
Okay.
All right?
Up, down.
So just tell me when I thought, yeah.
Stop. Oh, down.
Good, good. And with proprioception, I would do the same thing bilaterally and also with the big toe. Next, we'll test graphesthesia. So go ahead and give me your palm. I'm going to draw a number. You can close your eyes. You tell me what number I'm going to draw, right?
6.
Good. And then I would choose to do a different number with the other hand. And we'll move on to graphesthesia. So go ahead and close your eyes for me. I'm going to place an object into your hands. You just tell me what it is, all right?
Spoon.
Good. You can go ahead and open your eyes. And then I would use a different object with the other hand. So we'll assess some reflexes here. So go ahead and just let your arm go numb. Okay, then. Good. That's the bicep reflex, C5 and C6. Next we'll test the triceps, which is C6 and C7. Good. Then move on to the patellar tendon reflex, which is L2, L3, and L4. Nice. And then we'll do the Achilles reflex, which is S1. So bring her into a little bit of dorsiflexion. Right. Yeah. And then we'll do the Babinski reflex. So just stay nice and relaxed. I'll put this on the bottom of your foot. Sorry. All right, good. I'll let the patient know we've now concluded the exam. I will perform hand hygiene, make sure the patient is appropriately dressed, make sure the room is clean, and then conclude the exam. Thank you.